the cancer establishment basically is an emperor with no clothes. There's constant hype about how many advances we're making and how the pharmaceutical companies are doing such great things, when in fact nothing could be further from the truth. Over the past 50 years, there's been virtually no change in death rate in cancer, whereas several other conditions such as heart disease, there has been significant improvement. In my opinion, we're looking in the wrong direction when it comes to treating cancer. The emphasis, in my opinion, needs to be on focusing on the environment, person's toxic exposures, and on lifestyle factors, including nutrition.
There's a tragically low, minimal commitment to cancer prevention, and a shift to a greater emphasis on prevention would benefit the entire world.
We're in conventional medicine into treatment. We're not into prevention. The problem is once we start having cancer or diagnosed with cancer, the treatments are either burning it or giving chemotherapy and surgery. Yet nobody's talking about the core issues that got us here to begin with. So when I talk to my patients, I explain to them cancer is a systemic issue that we have to address before we even get to it. So number one is lifestyle, diet.
Any treatment needs to start with nutrition, because whatever you put into your body is going to affect how your body is going to handle whatever disease or imbalances there are.
Today, many people are both obese and malnourished at the same time. And it's a very unique form of malnutrition. It's a high-calorie form of malnutrition.
You know, the American diet traditionally is notoriously inadequate in many ways, and I believe it's particularly inadequate in terms of prevention against cancer.
The food substances that we know are bad in relationship to cancer are obviously animal meats because of all the chemicals and products in there. And certainly the animals that have a bad diet themselves, shrimp and shellfish, live off the junk that comes off of the land into the ocean. And those superficial waters have aluminum, arsenic, various chemicals in them, PCBs, so shellfish are bad to consume. Excess alcohol is linked with cancer. Excess alcohol is linked with gastric cancer and a variety of others, partially because of the topical effect on the lining of the stomach, but also because excess alcohol wipes out vitamins and minerals. In those individuals that eat charred foods and foods that are overcooked, especially meats, you're increasing carcinogen risk.
When you char red meat, it can cause esophageal stomach cancer and also speeds up, if you will, the aging process, because it creates a thing called AGEs, advanced glycation end products. So the more natural, the better.
For those people that have preservatives in their foods, there's another significant risk.
Many foods can cause cancer because of the way they're preserved, like salami and processed meats. Remember, cancer is caused not by one cause, but by a web of causes. And we have to identify as many of these contributors to this web as possible. And certainly the nitrates that are found in many foods is one of those factors. I believe that pesticides and insecticides that unfortunately have flooded our food supply also contribute significantly to this web of causation that leads to this epidemic of cancer that we're experiencing today.
We talk about the beneficial foods, organic vegetables, broccoli with indole carbinol, sulforaphane, any of the green leafy vegetables. Soy has genistein, datazin in it. When we look at garlic, it's a great immune stimulant. When we look at vitamin C, it can help to quadruple killer cells. So there are a variety of good things to have in the diet.
How do you prevent disease and cancer? A healthy lifestyle, and I call it the pillars of health. Leafy green vegetables, organic if possible, fruit as well. Trying to lean towards vegetarianism. It is a medical fact that vegetarians have less cancer and less heart disease. Drinking a minimum of 8 to 10 glasses of pure water a day, and more if you exercise.
One of the best things we can do is hydrate our bodies. And why not hydrate with some very high potency, highly nutritious fluids for our body? Coconut water contains electrolytes and minerals. It's wonderful for the body. And even coconut milk. Of course, it has to be unsweetened, and the less processed, the better. Another food I encourage people to take in regularly is green vegetables. Green chlorophylls, especially the brassica group, otherwise known as cruciferous vegetables. These are the vegetables, and that include things like kale and bok choy and broccoli and cauliflower, Brussels sprouts. These are just phenomenal foods. They contain specific chemicals, they're compounds, phytochemicals inside of the vegetable. One of them is called indole 3-carbinol. The other one is called carbene, and the other one is called sulfonophanes. Now, these three phytochemicals together work to actually prevent cancer cells from growing. It protects the cells.
For the prevention of cancer and for the treatment of cancer, it's very important to use green vegetables, both in juices and also fruits in moderation too.
What I encourage people to do is first and foremost start juicing green vegetables: cucumber, parsley, celery, bok choy, scallions, mint leaves. Make the green juices delicious. They don't have to be boring. They are natural diuretics. They're oxygenating the body. They're alkalizing the body. This is what the body needs to do to prevent cancer, and if cancer is there, to prevent it from even growing. The other juices I encourage people to do are red juices. And there you can put in a blender all your different berries or add berry concentrates, and you can mix that with your coconut milk or coconut water. And it's not only very hydrating, but again, it's protective. It's protecting every cell in the body. It's anti-inflammatory. Think of all the different berries out there. You have strawberries, blueberries, black cherries, you have pomegranate. There are so many different red berries, a lot of varieties. So when I have people that are prone to cancer or they have cancer, I encourage them to consume a lot of berries. They're basically low glycemic, and they're very protective and very healing to the body.
Now, in terms of diet, we differ from a lot of other doctors in that we don't just have one diet that we use. We have a variety of diets. We have 10 basic diets, ranging from pure raw foods, vegetarian, to diets where we actually allow a fair amount of animal protein. We have 90 variations of the 10 basic diets. And we're very specific in the kinds of diets we prescribe for each patient. Every protocol, every diet is individualized. So we try and assess each patient's metabolism, but there are certain ground rules that can make it simple. First, nobody should be eating white sugar. White sugar has no benefit for anybody. I mean, people have heard this before. Increasing evidence, even from the conventional medical world, is starting to question the safety of the 160 pounds of white sugar the average American takes in each year. And I don't eat any, so somebody's getting my 160 pounds, and I wouldn't want to be that person. You know, 160 pounds of white sugar is like a half a pound every 2 days. It's almost like taking a drug in huge amounts. It overworks the pancreas, does all kinds of negative things.
People just don't realize how harmful the foods that we've been conditioned to eat are to their bodies and how carcinogenic they are. In other words, how much they can cause cancer. And in a nutshell, these foods include soft drinks, alcohol, all of your caffeine-containing products, sugar especially. That's what cancer cells need to grow and multiply.
Cancer can utilize only sugar. It does not metabolize amino acids. It does not metabolize fats. It can only metabolize sugar. But everything that has what we call high glycemic index, which, just to illustrate, sugar has an index of 100. But white bread, white potato, white rice, white pasta has a glycemic index of about 90. In other words, it becomes sugar very quickly. So even if a patient tells me, I don't eat sugar, but then I find out that they eat any of these items, it's just about the same.
When you eat a lot of white sugar, you're stimulating your pancreas to produce extra insulin. Well, insulin normally drives blood sugar into the cells where it can be used to drive the energetics of the cell.